So as Tracy said, I am a personal trainer, a boxing coach, resistance trainer, all that stuff, and have owned and operated my own fitness studio for about 4.5 years now. My background is music education, so I am a teacher, which I love to do, but I found something that I love to do more. So I quit teaching music, and now I'm teaching the benefits of exercise. Like, people need to be educated. We know the benefits of exercise, but we forget the benefits of exercise. So we need someone there all the time to help us. And we don't always know what to do or what needs to be done. So that's what I love to do, is I just love to help people start from wherever they're starting from to attain any goal that they want, physically, posturally, range of motion-wise, lifestyle-wise, whatever I can do to help is what I want to do. And as Tracy said, this year I became a cancer exercise specialist because there's such a growing rate of cancer in the Maritimes, and I know that exercise and lifestyle can benefit. You can be proactive against it. You can be preventative against cancer. And you can feel the benefits of exercise through your cancer treatments, after your cancer treatments. So, again, anything that I can do to help that out, I thought, I have to do this. This is something that's just totally in my wheelhouse right now. So I'm going to not tell you anything that you don't already know today. I'm not going to bore you with a whole bunch of stats and studies and this and that. I'm going to tell you or reiterate what I always tell people, that you need to exercise, that you need to move, regardless of your situation. Unfortunately, we have a lot of conditions that will limit us, but only limit us, not eliminate. You should never eliminate exercise or a proper diet and a healthy lifestyle, because it will, in the end, benefit you greatly. So let's get started. I'm going to talk a little bit about cancer, just a little bit, and what I know of it and how I can help. So we all know the term cancer. We know that it refers to a group of diseases in which abnormal or malignant cells will divide and form additional abnormal and malignant cells without any control. In normal tissues, the rate of new growth of cells and cell death is balanced. In cancer, this balance is completely disrupted. This can result from uncontrolled cell growth or the loss of the cell's ability to undergo apoptosis. So apoptosis, or cell suicide, is the mechanism by which the old or the damaged cell will self-destruct. So that no longer can happen. So the problem with these malignant cells now that they're unable to perform the functions that they were meant to do, which is to replace any worn out old cells or repair the damaged cells. So the normal cell doesn't respond appropriately anymore, and it doesn't listen to the body's signals to divide when it's supposed to divide, or to stop when that need is fulfilled. So it's taken on a life of its own, and gradually the increase in the number of the cells will create your tissue of your mass, your tumor, your neoplasm. So regardless of how they grow, if they grow quickly, if they grow slowly, they grow two ways. They grow by invasion or metastasis. So invasion is the direct migration or penetration of the cancer cells into neighboring tissues. And the metastasis is when it penetrates into the lymphatics and the blood vessels, and it spreads throughout the bloodstream and invades the normal tissues. So, the causes of cancer. We think that heredity plays a big role, but it actually doesn't. It only accounts for 10% of all cancer cases. The number one cause of cancer, still smoking. It's still smoking. It's terrible. And our diet. All the pre-made foods and all the Hungry Man dinners and all the carcinogens that are in those pre-packaged foods are going through our colon at such a low rate, or, well, an extreme rate, and causing many, many forms of cancer. Inhalation would be, in the workplace, asbestos, for example. Radiation, X-rays, overexposure to X-rays, ultraviolet light, and radioactive chemicals. And viruses, the human papillomavirus, which we hear a lot of these days, hepatitis B and the Epstein virus. So the three main categories of causes of cancer are the chemicals, the radiation, and the viruses. But I'm going to talk a little bit more today about obesity because it's growing as a cause of cancer. We all know that obesity will cause higher risks of type 2 diabetes, high blood pressure, as well as heart disease. But every year, more and more people are being diagnosed with cancer, and the cause is obesity. And there's a higher rate of cancer-related deaths. There's a higher risk if you are obese when you are given that cancer diagnosis. It's so much harder to fight this horrible disease. So being overweight, being obese, will increase your levels of hormones in your system. This is what the studies are going on as the cause, or one of the causes. So you have increased insulin and increased estrogen in your system, which can trigger cancer cells to grow. So it's also shown that higher risks or moderate risks of cancer if you are an adult and you gain excessive weight as an adult. So if you're a healthy young person, and once you hit adulthood, you gain an excessive amount of weight. This is also can be a cause of cancer. Also, those yo-yo diets that everybody goes on, those extreme weight loss plans, those extreme exercise programs where you're dropping 40, 50 pounds, and then you're gaining 50, 60 pounds, and then you're dropping, this is very dangerous to your system as well because it really messes up the hormones in your body and will allow those cancer cells to attack and grow. I'm going to talk really quickly about this, but I'm going to talk about my personal stories with these types of cancers. So the types of cancers that we have are 90% of all cancers are carcinomas. These arise in the epithelium, which is the membranous tissue that forms the inner lining and the outer covering of all of our organs, glands, vessels, as well as the surface layer of our skin. This is 90%. The other 10% are made up of, I'm missing one, the following. So sarcomas, cancer of the bone, the cartilage, the muscles, and the vessels. Leukemias in the blood cells, and the bone marrow. Lymphomas in the lymph nodes in the lymphatic system, and the melanomas, which is inner skin cells that produce the pigment. On the bottom is our gliomas, it's cut off, sorry, which is our brain and our spinal cord cancers. So I'm going to talk about two different stories now, how I'm personally affected in my family. I mean, you can't find a person who's not affected by some form of cancer. I'm the youngest of 6. I have 2 sisters and I have 3 brothers. And I have 2 brothers that are terminally ill with cancer. Excuse me. I'll try not to cry. My oldest brother, David, is 67 years old. Very fit, very healthy, retired lieutenant colonel in the Army, very physically active his whole entire life. At 60, he was diagnosed with B-cell lymphocytic leukemia. Now with this leukemia, there comes two markers. The first marker is the chronic marker, which is, you know, you have leukemia, you're going to live with it, you're going to be sick, but you can, you know, you can maintain your lifestyle, be careful of infections. Unfortunately, my brother has the acute form of this disease. So he was given 5 to 10 years to live. He is in his 7th year, and he is asymptomatic for the most part. He's anemic, quite anemic, and has lost a little body weight. But he just told my parents that he's a runner because they don't know he has cancer. He was like, just took up running. So he has maintained a healthy lifestyle, very active, very healthy, and a very healthy diet. And he's living with it. He is thriving with it. Yes, he is close to his 10-year marker, but I believe that he will easily surpass that because he's taking all the right precautions. He's got a great mental attitude. He's taking care of himself. He rests when he needs to rest, when he's tired. He's careful to stay away from, well, I shouldn't say that. He flies all over the world. He's traveling a lot, so I worry about him that way. But he's very physically active, and he is fighting tooth and nail, and he will till the very end. And he knows that he has done his ultimate, his best to fight it. So unfortunately, I have another brother who was diagnosed with kidney cancer 2 years ago. He's in PEI. He came here and had his kidney removed. No problem, we got it all, everything looks good, go home. But unfortunately, my brother was not physically active, was not physically fit when he went in the first time to get his kidney removed, and was quite large. Obese, he was. He started off his healthy weight as an adult, 175. He's now 275 at least. He's gained at least 100 pounds, and he is morbidly obese. After his cancer surgery, unfortunately, because of his obesity, he had a herniated disc and had to have back surgery. So, not physically active whatsoever. Poor diet. Processed foods constantly. Simply because he couldn't stand to make a meal. He can't physically stand up for long periods of time. So it's easier to pop it into the microwave and have that hungry man dinner, right? So unfortunately for him, and you can talk, but people have to do in order to make things happen. So I said, you really have to be careful. You have to get physically active. You have to move. You have to walk, do something. Because the chances of a secondary malignancy, if you're inactive, if you are obese, skyrockets after your first cancer. So unfortunately, 3 weeks ago, he came here last month or so to get his annual CAT scan to make sure everything was okay. And he got a call a week later saying, we need you to come back right away. So he came back right away, and unfortunately, he was diagnosed with small cell carcinoma in his liver. So, sorry, 1 second. So, that's fine. He never even thought about it. He thought, oh, that's great, I got my kidney out last year. I'll just, take the tumor out. No big deal. Thinking, not even understanding the ramifications of his diagnosis. So, I went home last week, 2 weeks ago, and took him to his first oncology appointment. So the secondary cancer is the small cell carcinoma. They don't know where the primary is yet. They're assuming it's in his lungs. So he's in the process of, he got his bone scan yesterday, and he starts his chemo on Monday. But he still doesn't know what the primary cancer is. He still doesn't understand the ramifications of his liver cancer, which is peppered. And because of his obesity, he won't be able to fight this. He will pass away. All right. within a year. Like he doesn't stand a chance because he's so obese. I'm sorry, I didn't mean to cry. So, the moral of the story is you need to be active. You need to take the opportunity now while you're feeling well. If you're not feeling well, find somebody to help you. They can help you. I'm here to help you. There's dietitians to help you. There's nutritionalists to help you. There are counselors to help you. Friends and family can help you if you ask for the help. If you don't want to do the help, if you don't want to do the work, your chances are the same. You're not going to beat anything if you don't try. So, if anything I learned as a boxer, you keep fighting. You have to fight. Unfortunately, I have one brother who's a huge fighter, but unfortunately, I have one who is not. Okay, sorry about that. So, once you have been diagnosed, and there's a lot going on, your body's stressed, your mind is stressed, you're probably maybe feeling a little sick. These are, there's a lot going on after your diagnosis, right? So you're going to have a lot of mental and physical fatigue, but there are certain things you can do to help alleviate a lot of this stuff, right? The fatigue is caused by your chemotherapy, by your radiation, by your low blood count, any surgery that you've had, you have a lack of appetite, you're stressed, you're not sleeping. There's so many reasons for your physical and your mental fatigue. The mental fatigue is noted by patients as having, like Melissa said, foggy brain, right? So it's referred to as attentional or mental fatigue, chemo brain, foggy brain, all that stuff. Plus you're dealing with this new reality, right? Like, what is this? It's your new existence, right? It's all this critical information you're taking in about your disease, right? And your emotions are extremely high. It affects your quality of life. It affects how you deal with your everyday life, how you deal with your children and your friends and your family and your job and other things that have meaning to your life, right? You become overwhelmed and you feel scared and helpless. All these emotions are going through, and they all affect your mental and your physical well-being. So you need to concentrate on conserving your mental health. Plus, restoring your mental energy is just as important as conserving. So there's some ways, some tips that you can do to help reduce and conserve your mental energy. Prioritize things. We're just doing so much all the time, right? We're just, if you're anything like me, you got 10 things on the go at once. So take those down, cut those off. Only prioritize to what is really important and get those done first. Take your large tasks, any of your big deals that you're doing, break them down into smaller, achievable goals. And that goes as for physical fitness as well. Don't think you're going to go climb Mount Kilimanjaro. Take little steps. Go for a walk. Make reminders of lists. Everybody's got an iPhone now. Put it in your notes, right? You can do it. Keep things simple and free of distraction. Meditation's great. Music, things like that. Refocus your mind. Deep breathing. And taking your naps. Relax when you can, relax. Don't take huge long naps. Take short naps. You'll feel much better for it. So for our physical fatigue, that's usually caused, by the stress of getting yourself to your treatments. But your chemo and your radiation will affect your body. Your body's fighting this, and it has to try to heal itself all the time, right? So your body's feeling very tired all the time, on top of all your mental stress. So, but this varies from person to person depending on your treatment, right? So what's really important is when you're doing your treatment, you need to be physically fit and physically as fit as you can, but only do what you can and don't do too much. Never overdo it. You really need to take this time because your body needs to try to heal. just make sure you don't overdo it. So try to get as much sleep as you can at night and take those rests during the day. They are essential. Like I said, it varies from person to person, right? So some people can continue to work their full-time jobs while they're doing their treatments. Some people have to retire. Some people can cut back on their hours, right? People will be affected differently, right? And like Melissa said, don't be afraid to ask for help. If you need help with the kids, if you need someone to go get your groceries for you, if you have that support group, if you're lucky enough, ask for the help for your daily chores and other things that you need, right? Also, another effect of your physical fatigue is that the chemotherapy reduces that bone marrow, right? So it reduces the ability of the bone marrow to make those red blood cells that transport all the oxygen through our body, right? That makes us, helps us move and keeps us motivated. And we're not getting enough oxygen into our tissues to be able to be physically as active as we want. So we have to make sure that we take our time and be careful with whatever we do physically. So obviously, when you don't have enough red blood cells, you become anemic, right? So you're very tired, and this will really compound everything else that's going on. But there are ways to offset your physical fatigue. Limit your daily activities. Again, prioritize what you need to do, what needs to be done, not what you want to do, what you need to have done, what you can physically do. And if you can't, hand it off to somebody else who can. Ask your friends and family to help you go shopping, cooking, housework, take care of the kids. Eat a healthy, well-balanced diet. Seek the help of a nutritionist or somebody who just knows a little bit more about food, right? Somebody who knows the good foods to put into your body, like kale and all that green stuff and the spinach and the arugula and all that good stuff and those bright vegetables that we need. And unfortunately don't put enough into our body. And because you're anemic, because you're tired, please make sure that you're not getting up too fast and trying to get down too fast, because you'll get dizzy and fall down, and that wouldn't be good either. And on the bottom it says try easier or shorter versions of your activities. So if you really like to go for a jog, sure, go for a jog if you think you can. Just go lightly. Maybe take a friend with you. Take it easy. And you can do anything as long as you feel well enough to do it. Don't push yourself beyond your limits. Okay, let's get into it. Why is this so important? Why do not enough people know this is so important? There's a lot of studies out there that suggest that increasing your physical activity, including a structured exercise program, is associated with certain types of cancer. It's actually shown that high levels of physical activity can prevent colon cancer. Why wouldn't we do this? Also, there's also studies that show that breast cancer, prostate, lungs, and uterus cancer have also been linked to cancer-related prevention. So there's lots of studies out there, scientists are out there studying the biological impact that exercise has on the risk of cancer. Some of the methods that are being studied include the maintenance of a healthy body weight and that overall amount of body fat. So if we can reduce our body fat gradually, excuse me one moment, we can reduce the process of increasing those hormones, those insulin and estrogen hormones in our system. Maintenance of the low fat in and around the abdomen. This is our danger zone. If you see the fat out here, there's just as much fat inside pressing against those organs. Maintenance of the biological system that regulates our blood sugar levels. So our risks of type 2 diabetes, right? So we really need to watch that. Again, that's on the rise, along with obesity, along with cancer. It's all connected. Control of some of the tumor growth factors, again, the hormone-related growth factors, and the suppression of prostaglandins, which are the hormone-like substances that are released in greater quantities by those tumor cells. A few more. Improved immune function, including your increased level of those natural killer cells that are doing their job and they're getting rid of those old dead cells and those damaged cells. Reduce symptoms of mild to moderate anxiety and depression. This may also improve immune function and overall physiologic function. So, exercise produces endorphins, those happy hormones, right? So, if we can release those happy hormones and get our belly happy and our mind happy, then we're going to eat better. We are going to feel better. We are going to sleep better. It's all a chain reaction. Last one is being studied is the increased levels of free radical scavengers to assist in the body in preventing the DNA damage. So it's not known exactly how high amounts of exercise and physical activity work to prevent cancer, but we do know that exercise prevents obesity. And obesity, if we can reduce the amount of obesity, we can reduce our risks of cancer. And also, because we exercise, we're increasing our metabolism. So that also increases the passage of the food that goes through our colon because it's working faster. Our metabolism is working harder. And if we are eating a poor diet with processed foods full of carcinogens, they will pass through the colon quicker because we're moving faster. So the mucosal lining of the colon won't be in contact as long with these carcinogens in our food. So we're pushing it through our bodies faster and hopefully eliminating these carcinogens faster. Also, if you exercise, what are you less likely to do? That's a good one. What else? Smoke. If you exercise, you are less likely to smoke. I walked into a boxing gym when I was 30. I was a smoker. I smoked since I was 10 years old. I was good at it. I thought it was great. Oh my gosh, I'm such a good smoker. Anyway, so I walked into a boxing club and I found it. I found that exercise that, just like a light went on in my head. This is it. I'm something else I'm good at. So I threw those cigarettes away and I haven't smoked in 18 years. You have to find something, if you are smoking, you have to find something that will get you off those cigarettes because it is the #1 killer still. And exercise is a great way to do it. So if you are in the middle of a treatment, maintaining an exercise program will not only make you stronger, both mentally and physically, but will help you get it through the treatments better. Your mental attitude is better. Your physical fitness your physical being is better. There's 24 studies were done by the University of Alberta, and these are in the Annals of Behavioral Medicine. They have consistently shown that physical exercise following a cancer diagnosis has a positive effect on the quality of your life. Because you have increased stamina, increased functional capacity, strength, self-esteem, improved treatment tolerance and satisfaction with your life, and decreased pain through your treatments. Psychological changes, including the decrease in total mood disturbances, because you're releasing those endorphins, those happy hormones are fighting those depressions. So it's decreasing your depression, and it's helping you sleep better. Your body is in a better physical state, and it will allow you to sleep. You're physically tired, which is good, and you will sleep better. Less fatigue during and after your chemotherapy and radiation. Most back. Okay, sorry, I went ahead too far. But the specific dose, we call our exercise dose, which is the frequency, the intensity, and the duration of our sessions, needed to improve our function, our psychological function, our physical function, will differ according to your treatments, right? So if the different forms of treatments will affect different things. Childhood cancers are treated and have long-term negative effects on your lungs and your heart. Amputations, mastectomies, lymph node dissections. There's the treatments are different, right? But there's always a physical, there's always an exercise program. There's always something you can do to help offset any of these. But because you've had these treatments, because you've had these surgeries or amputations, you need to make sure that you do this under your medical supervision. Make sure the doctor okays everything before you do anything. And that you work with the cancer exercise specialist and your physiotherapist and your dietitian as a group so that you can move forward from it. But it can be done. After your surgery, exercise plays an invaluable role of helping you return to the strength and fitness level that was maintained prior, hopefully, was maintained prior to your surgery. But in many cases, due to your lack of exercise beforehand, if you start exercising afterwards, you'll be able to reach new heights in your strength, in your flexibility, and in your cardiovascular conditioning. And as I said, if there's been amputations, you're going to have certain postural implications that'll arise from the mastectomy or a lymph node dissection and by reconstruction and radiation. So anytime there is an amputation, it'll result in some kind of muscle imbalance, and these don't correct themselves, ever, unless you do something about it. And we usually there's always physiotherapy involved, but unfortunately, even patients who undergo physiotherapy are released long before that they're fully recovered. So it leaves them to go it alone. So what do you do after this? You have to find somebody else to help you finish it. Radiation also may result in tightness and scarring, which contribute to your postural deviations. We have postural deviations in our daily life. We're bent over a desk. We have the phone in our ear. We're holding on to a baby, or we're carrying a heavy purse. So this is only compounded by any kind of surgery or radiation. Radiation can create scarring, which can also compound. So if you come to myself, you would get a complete postural analysis and assessment. So you need to determine what areas in your body needs to be stretched to relieve your tightness and spasms, as well as what needs to be strengthened to create that counterbalance. So let's not forget about the benefits of cardiovascular conditioning. Biking, running, swimming. Swimming is phenomenal, especially mastectomy patients. To get that range of motion back, that's very, very important. Less stress on the joints. And also releases a lot of endorphins. Get out there and walk. It's actually spring out there today for the first time. So hopefully you guys get to go out and enjoy it. Again, the cardiovascular conditioning can help strengthen the heart and the lungs after your chemotherapy because it has incurred damage. So, along with the benefits of exercise, nutrition is key. So there's not even a question anymore that good diet is essential for our optimal health. It's not even a question anymore. We can't eat what we used to eat, all the fats and the sugars and the salts. We know there's absolutely no way that nobody knows anymore with all the advertisements and everything. This is bad. So we know the foods that we eat, we know our lifestyle choices affect our health. So food, nutrition, and physical activity are crucial in our general health. And it also affects our long-term risks of developing diseases such as cancer. All kinds of scientific research validating the association of poor dietary choices and the onset of degenerative diseases. As a matter of fact, the American Cancer Research Institute for Cancer Research has estimated that between 60 and 70% of all cancers have been directly linked to our daily diet and lifestyle choices. 60 to 70%. That's pretty huge. But on the flip side, you can do something about it. You can change your lifestyle. You can, not big steps, like I said before, take a little baby step, change your diet, add some greens, go for a walk. They'll all make big differences in your life. So the three main categories of somebody living with cancer, nutritionally, that you have to, your goals, your nutritional goals. You need to maintain a healthy body weight as much as you can. So select a nutritional plan that supplies your body with the fuel. You have to think of food as fuel because it's there to repair and heal your body and give you the proper nutrients to do so, and eliminate toxins as well. Also, it prevents recurrence of cancer with the development of a secondary malignancy. While it may be overwhelming to administer radical changes, it's got to be understood that if you refuse to make substantive modifications in your lifestyle, everything will stay the same. Nothing will change. Your risks will remain the same. So the cancer risk and the potential will be unaltered. Researchers, this is kind of scary, researchers predict that the current rise in the incidence of obesity, because of the incidence of obesity, cancer rates will escalate by 50% by the year 2020. So the premise is, again, by being significantly overweight and inactive, it produces those dramatic hormonal and metabolic changes that create the optimal environment for the onset and that's a nice word, proliferation of cancer cells. So simply put, you need to follow some steps to sustain weight control and help out with your lowering your risks. So there's five effective ways to try to control your weight. Move towards a plant-based diet. Start eating more greens. Get the kale into you. It's good. Consume mineral-rich foods that fulfill your body's needs for the nutrients. Think of food as fuel. It provides lower calories, higher fiber foods that usually reduce your unhealthy cravings for sugar. If you eat sugar, you're going to want more sugar. It leaves you with the craving for more sugar. Reduce sugar, eliminate sugar if you can. Watch your portion sizes. This is huge. I spoke to a group of construction workers this week. They work all day, they get home, and they have massive plates of food in front of them. I know because my husband's a construction worker. So, condition yourself to eat only when you're hungry. I know it's hard, but you will get used to it, and it will be part of your lifestyle. Pause after each forkful, take a breath, chew your food. It does, you will feel yourself filling up faster. If you eat so fast, you don't know you're full, and you keep eating. Take your time. It also will enhance your portion consciousness. Keep physically active. Exercise burns those calories, it regulates the metabolism, speeds it up in some cases if need be, and it relieves your stress and may reduce your urge to eat. Go slowly. Don't do any of those crash diets. Don't go on. Buy those DVDs and do those crazy whatever the heck is out there these days. I don't even know. You have to take it slowly. Exercise and diet has to be a gradual introduction into your life if it's not already there. Focus on healthy eating and exercise, and it will provide sustained results if you do it right. Learn to control our responses to life stresses. Like Melissa said, she's found that music reduces her stress and gives her some focus. Whatever you can do to do that can help with your uncontrolled binging. It can take the mind off of the pain. It can take away a little bit of your stress. I find deep breathing is phenomenal. I mean, just taking that time to focus on the breath alone, focus where the breath is coming from, will calm your system down. It's a regret of the past and fears of the future that proliferate, I'm having trouble with that word today, much of our unresolved stress. So learning to live in the present can have a dramatic effect on our ability to reduce stress in our lives. So the main points: achieving and maintaining a healthy body weight is an essential component of cancer prevention and treatment. Gradually reducing your body fat and keeping it off is a strong step in the direction to help protect against cancer and assist in its treatments. Thank you.